So we are live. We are live for everybody online. We are here in Columbus, Ohio. We haven't been here since 2022, so it does feel good to be back. Our program is sponsored by Novartis Pharmaceuticals and TG Therapeutics, and we can't do these programs without them, so let's let them know that we thank them. Thank you. And Dr. Megan Weigel is from Jacksonville, Florida, and she's a very well-known doctor of nurse practitioning. She has been working in the MS space for quite some time. I've known her for about 15 years already, and she just does a phenomenal thing for the people that are in her region. People just come from all over. They want to see Dr. Weigel as their practitioner. Take it away, Megan.
All right, thanks. It's nice to be here with you today. I'm going to talk to you about integrative medicine in multiple sclerosis care and why it is important. I call it holistic with a play on words because I truly believe that the whole, treating the whole person, all parts of you, is basically the best way to treat your MS. So we're going to just share some simple facts about multiple sclerosis today, talk about typical MS treatments, just very briefly. I know that's not my position today. And then we're really going to talk about holistic types of care, why it's important, what the evidence is, and how you're not a system. You are a system. You can't silo your other medical problems because everything affects the other thing. Healthy choices improve the system. And so I just want to help you choose wisely to improve the health of your mind, body, and spirit today. Let's see if I can just close this out so that I can actually see my slides. All right, there we go. So, of course, you guys know about MS. Some of you are probably new, and welcome. I think that this community is an amazing community where people get a great sense of support, and also wonderful knowledge comes from these programs. So welcome. I'm sorry that you have multiple sclerosis, but I also hope that you're one of the many people I've met over the years who said MS is the best thing that's ever happened to me. And that may be because they met their best friend or their partner, or even they had a major lifestyle change that resulted in them feeling better than they did even prior to their MS diagnosis. MS affects over 1 million people in the US, 3 to 4 women to 1 man. According to new research, we think that the MS incidence is not that higher in Blacks and non-Hispanic whites than it is in people of Caucasian descent. There is a higher risk in smokers, in people who have low vitamin D, obesity in adolescence, or a history of clinical mononucleosis in adolescence. Hundreds of susceptibility genes have been discovered. So when people say, is there a gene for it? Yes, there are hundreds. And one vascular comorbidity that occurs at any time in the disease course causes progression to a higher level of disability, specifically an EDSS of 6 by 6 years sooner. There are over 25 disease-modifying therapies approved to treat active relapsing forms of MS and 1 to treat primary progressive MS. And lifestyle changes improve symptoms and may help modify the disease. So MS treatments. Okay, well, first of all, we've got the root of our treatment. That's disease-modifying therapy. There are over 25 choices, and there are several generics. And so the 25 plus came on for me a couple of months ago with the approval of Tyruko, which is a biosimilar for natalizumab or Tysabri. But we can't just treat the disease. We also have to manage your symptoms. It tends to be the symptoms that affect your quality of life. And we do that with medication, with rehabilitation strategies, with adaptive aids, with social changes. And I would argue this is where integrative medicine or lifestyle medicine or holistic care fits in the most prominently. We also manage relapses. Well, if you are diagnosed early in the disease, your relapse frequency, and you're started on a high efficacy therapy, your relapse frequency is going to be a lot less than it would have been 10, 15, 20 years ago. But we manage relapses with steroids, with ACTH gel, severe relapses with plasma exchange. And then this mind, body, spirit, and general health care that I'll talk about today really help to keep your roots strong, promote adaptability in you, in your body, in your personality, and it cultivates resilience. So this is just a nice little slide. You are the tree. Your roots are the disease modifying therapy. And then these are the things that you need to grow. So you need social activity. You need to stay active in your community. You need that community support. You need sunshine. Literally, you need vitamin D. We like higher levels of vitamin D in MS, but you are going to be affected by things like wind and rain, right? Things that cause down days, cause you to feel dreary, like our prior speaker just mentioned, and improving that mental health capacity is so important, because no matter what you're faced with, if your roots are strong, then your tree's going to be full of life and it's going to continue to grow in spite of multiple sclerosis. So this is a quote that I took from my book, Monday Mantras with Megan, and I love to share this visual with you. So each of us has a cup that we can hold and we can handle. Our cups fill with all sorts of exposures and stuff as we get older: illnesses, trauma, toxins, crappy food, bad air, toxic stress, not to mention the genes that we're born with. And these things are chronically inflammatory to our bodies, and inflammation is bad for our health. There will come a point when your cup will overflow or even tip over if all you do is put stuff in it. Overflow looks like a breakdown, a major medical illness, a smoldering problem that finally gets your attention, or any number of other life-altering events. And so what we're looking for is a release valve on that cup. So when the water level gets high, you've got a way to release the stuff that's in it. Integrative medicine is healing oriented. It takes into account the whole person, the relationship between the provider and the patient, and it makes use of all appropriate therapies that have evidence to support their use. It focuses on the least invasive, the least toxic, and the least costly methods to help facilitate health. And these therapies are recommended based on an understanding of all parts of you: physical, emotional, psychological, and spiritual aspects. It maintains that healing is always possible, even when curing is not. And that's why I have had the absolute honor of being in the lives of patients who have said MS is the best thing that's ever happened to me, because they were able to recognize healing even when their condition was not cured. This is the pole of integrative and conventional medicine. So on one side, you have conventional medicine. It's disease focused. We treat symptoms with drugs, with surgery, with radiation. And it's basically what our foundations are based on in Western medicine. And there's nothing wrong with it. Surgery saves lives. Emergency care, acute care saves lives. Cancer therapy saves lives. Antibiotics saves lives. There's nothing wrong with this type of medicine. But when you are disease focused, you tend to forget that if you're health focused, you are likely going to prevent a lot of that disease. And that's where these other types of medicine practices come into place. Alternative medicine is used in place of conventional medicine. It's when people say, I want to do something natural. They don't want to participate in any type of Western medicine to help with their condition. And the treatments that they might be using have very little scientific evidence that they work. Complementary medicine uses both conventional and alternative medicine to diagnose, treat symptoms. It's a hybrid. And so this would be something like, you live with MS, you have spasticity, and you're going to see a massage therapist, and that's really helpful for you. Integrative medicine combines the conventional and the alternative medicines in a coordinated way. It tends to be based on evidence and the other things that I talked to you about. And then functional medicine and integrative medicine, they sort of run this parallel road these days, as does lifestyle medicine. But functional medicine is really based on naturopathy. It treats the patient, not the disease. It's based in systems biology and biochemistry, and it focuses on prevention rather than treatment, although the treatments that are used in functional medicine do tend to be more based on natural therapies or nutraceuticals. And the evidence for functional medicine, while it's growing, it's still limited in humans. So I mentioned vascular comorbidities earlier. What are they? Well, in MS, relevant vascular comorbidities associated with more rapid progression to disability are diabetes, hypertension, high cholesterol, heart disease, and peripheral vascular disease. These are the most common vascular comorbidities in MS. And why are they important? Well, like I mentioned earlier, they can worsen the course of the disease. They also provide us with an additional opportunity for education, particularly for preventive health, to improve your state of health and to empower you to make healthy lifestyle changes. These comorbidities also hasten biological age. So what's biological age? Well, biological age is how old your body thinks it is based on all those things it's been exposed to in the past. Chronological age is actually how old you really are. So increased, I should say, short telomeres are parts of your genetic makeup. Shorter telomere length, I think Dane's behind me, just had a soccer game. Shorter telomere length is associated with higher levels of disability and lower brain volume. Telomere length is associated with disability progression and multiple sclerosis. So really looking at this biological versus chronological age, I'm so sorry, is important. I think it's okay, buddy. Can you have your dad take these off? Thanks so much. It's okay, buddy. So what else affects brain health in MS? Well, smoking, dehydration, nutrient poor diets, lack of exercise, physical and emotional stress, poor sleep, and infections. And I just want you to think about your MS for a second. And think about how your spasticity or your brain fog or your fatigue might be when you're dehydrated, or how those things might be when you're under significant stress, when you don't get good sleep the night before, or when you have a UTI or the flu or something like that. Why does this happen? Well, these states directly or indirectly create stress in the body that disrupts homeostasis. Homeostasis is it's like your level of cool and copacetic in the body. Everything's working out the way it should. The seesaw is balanced. When homeostasis is disrupted, you have fight or flight responses that don't go away. You have immune dysregulation, inflammation, and what is primed to go awry will do so. So that can look like illness. It can look like an MS relapse. It can look like, for chronic states of disease and health, it can look like this is when multiple sclerosis might show up. So let's talk about mind, body, and spirit. On the left here, you've got a caveman. He's running from a tiger. He doesn't have to do it very often. It's super scary. But when he gets into his cave, the tiger can't fit and he gets to calm down. He calms down pretty quickly. He's like, phew, that was scary, but probably won't happen for another couple of months. So I'm good. I know not to go that way again. On the right-hand side of the picture, what you see is today. And today, people are always running from the tiger. You have this guy, let's call him Joe. He's pulling his hair out because the tigers of work, of traffic, of the child, of the discipline, of the spouse, of the news and how angry it makes him, of his cell phone that never stops running, of money that he doesn't have enough of. All of these things cause him to be running from the tiger all day long. And those fight or flight responses, they never get the chance to chill out. So what does Joe need to do? He needs to manage his mind. He needs to plan to manage stress, including the what ifs. And by the what ifs, I mean, what if I have a relapse? What if my insurance changes? What if I can't get or what if I'm going on vacation and I need a refill of medicine? These are all things that you can plan for in advance. So when when the opportunity for stress hits, you can say, oh, I have a plan for that. Make a manageable to-do list for each week. Have support team contacts available in case you need them. Limit news watching, reading, social media time. And if you're compelled to do those things, don't do it right before bed. Prioritize your health and take care of it, and schedule time for body and spirit. You just had a great talk on mental health and multiple sclerosis. I'll say very briefly that depression and anxiety are common in MS. And if you aren't asked about them at your provider's office, please share your concerns. Ways to manage stress include talking to a healthcare provider if it's something that's disrupting your life. You may be referred for talk therapy or medication if needed, or you may choose to use one of these forms of complementary and alternative therapy like acupuncture or Reiki or therapeutic touch. Meditation, mindfulness, and breathing exercises are very helpful for stress. Exercise, moving your body, however that looks like for you, can significantly reduce stress. Getting outside, just fresh air, being in nature has been scientifically shown to reduce stress. And then there are these things that we put into our body that make stress worse. We think that they make us feel better, like, oh, I have a couple of glasses of wine at night to just chill me out. Well, it actually doesn't. It significantly affects your sleep, it drives up your heart rate, and it makes you dehydrated, as does the dessert that you eat or the sugar that you eat that helps with your stress level. So decreasing caffeine, also something that amps you up. Decreasing alcohol use, sugars, and processed foods in the diet can help you manage stress. Increasing omega-3s and plant-based foods in the diet can help you manage stress. And learning to say no can help you manage stress. If you take her right outside, you can take her out. I'm so sorry. So the other thing that can help you manage stress is managing your health. Keep regular MS checkups. Don't put them off. Those of you who've known me for a long time know that I say things like, if your doctor tells you to come back and see them in a year and you're not comfortable with that, say, hey, I'm not comfortable with that. I want to come see you every 3 or every 6 months. It makes me feel like I have a better handle on what's going on with my MS. MRIs are recommended annually. You want to know if there are changes. If you have new symptoms or any disability changes, you want to be able to report those to your healthcare provider. You want to know if your disease-modifying therapy is working for your MS, and well, ask yourself, is it working for you? Same thing with your medications for symptom management. Have you noticed a decline in your ability to move around? Do you need a rehab tune-up? Do you have any pain? Do you need any specialty referrals? How about other medical conditions? Are you seeing a good primary care provider, which you absolutely need to be doing? And then if you have any of these problems and you are not sure that you want to treat them with medication, are there alternative therapies that could help you? Let's talk about your body. We're going to talk about nourishing, moving, and resting your body. So my favorite quote is by Michael Pollan. I still spell his name wrong on this slide. I need to fix that. But eat food, not too much, mostly plants. And then, a lot of people get worried about the right diet for MS. I say the right one for you is the one that you will follow. So if you're a recipe person, there are so many different diets for MS. And if you're pulling recipes from any of those, you can know that you're doing better than eating a bunch of processed foods that are high in saturated fats. Drink plenty of water daily. And if you want to start small, take a look at your daily intake and think, what can you take out? Can you take out soda, alcohol, sweet tea, processed snacks, or desserts? And then think, what can you put in that's easy? Maybe it's a handful of greens with each meal. Maybe it's chia or flaxseed and oatmeal for breakfast. Just starting small can make you feel empowered. The standard American diet is sad. It's high in refined grains, sugars, and sodium. It's high in convenience, chemicals, fake foods, and fillers. It's missing nutrition, real food, and variety. And it causes all of these things listed on the right, which in turn are associated with the vascular comorbidities that we know increase disability in MS. I want to talk for a little bit about the enteric nervous system. This is the gut-brain connection. So we've got this lady in the middle. She's got way more to her than just a brain and a gut, but that's what we're going to focus on. So up here on the left-hand side, we have environment, stress, and early adverse events. Those things have already affected her neurohormones, her HPA axis and her autonomic nervous system. When she has a lot of these problems and her neurohormones are affected, those neurohormones in tune cause immune dysregulation, intestinal permeability, they slow reflexes, and they slow GI motility. So guess what we have? We have constipation. Maybe we have IBS that goes back and forth between constipation and diarrhea. We have poor absorption of nutrients. And so then this woman, if she's putting in the right food, probiotics and prebiotics, then her gut just might be okay. But if she's not, and then she's putting in medications that also affect absorption of nutrients, she's putting in literal bugs or bacteria, and then there's inflammation, then we're going to have messing up of bowel habits. So then we've got, let's talk about things going up in the other direction. We have these signals coming up to the brain from the vagus nerve, which goes from the brain to the gut. And the vagus nerve is saying there's something wrong in the gut. We've got to do something about it. And so there are these signals of inflammation and microbiome changes giving feedback back to the brain. And the brain is saying, are things calm down there, or are they stormy? And I'm going to mention my favorite little guys, microglia. So these are like the trash men of the brain. And when everything is calm, they're pruning, maybe the gardeners, they're pruning the things that need to be pruned in the brain. When things are stormy, they prune things that don't need to be pruned in the brain. And so these little guys may actually be part of the problem that we now know is causing things like cognitive issues, fatigue, and some of these more symptoms in multiple sclerosis that we just haven't been able to put our finger on. So how does food fit in? Well, we have really good evidence now that says that receptors from foods high in fiber and omega-3s stimulate anti-inflammatory effects. Flavonoids, which are lovely chemicals that we get in brightly colored fruits and vegetables, activate anti-inflammatory effects. Short-chain fatty acids that come from high fiber foods cause anti-inflammatory chemicals to be produced in the gut. Foods high in polyunsaturated fatty acids are anti-inflammatory, and in animal models provide evidence for neuroprotection. Higher levels of intake of fruits and vegetables have been associated with reduced relapses and disability levels in MS, as well as decreased recruitment of inflammatory cells and proteins. On the flip side, saturated fats are pro-inflammatory. They increase the types of interferons and interleukins that cause inflammation in MS. Long-chain fatty acids, which come from processed foods, seed oils, foods high in omega-6, stimulate baby T cells to become inflammatory. And these same foods also increase the risk for vascular disease. So hopefully now you can start to see how one doesn't, they don't live in silos, right? Our bodies are affected by each other. This is a very quick snapshot of all of the diets that tout evidence for MS. And I do believe that any one of these is better than the standard American diet. Some of them have more research because they've done it in multiple sclerosis, but you can pretty much take a look at this table and say, well, there's no way I'm going to give up meat, so I can't do the Swank diet or the Mind diet or the McDougall diet. Well, there's no way I'm going to give up dairy. So I'm not going to look at the Walls protocol. So that's how I put this table together. Let's talk about supplements briefly. People take too many supplements, period. People take them without guidance, and it results in supplement disease and drug supplement interactions, as well as financial harm. People with really unhealthy guts take supplements and then can't absorb them. It's like pouring water into a boat with a hole in it, or I guess it's the other way, dumping water out of a boat with a hole in it. It's way better to eat what you need. However, safe supplementation can alleviate symptoms, and this can create an environment for healing. A really good example is magnesium. Magnesium can be helpful for constipation and for muscle tension and for headaches. And if you take magnesium and your constipation gets better, just think what that can open up for you. Supplements that are probably safe and helpful in MS are vitamin D3. It's important to have your level measured before you start taking it. Alpha lipoic or R-lipoic acid. I mentioned magnesium. B vitamins like B6, folic acid, and B12. And again, these should be measured before you start taking them, because if you're not deficient or insufficient, then you don't need to take them. And then a good quality multivitamin, multimineral. And this is, I put a question mark here if your diet is not well balanced, but I would argue that even if you do have a well balanced diet, our soil just isn't as great as it used to be. It's not creating the same quality of nutrients and foods that it used to. And so a good quality multivitamin, multimineral is important. I think that probiotics, CBD, and the use of adaptogens should be individualized. Quick snapshot about moving your body based on what you enjoy, a goal of 150 minutes per week. When you're looking at a little more than 21 minutes a day, it's not so daunting. Move at your best time of day, involve your friends and family, split up exercise if you need to. And because when most people with MS get warm, nerve conduction slows down and requires more energy. It's important to stay cool with cool fluids and cooling equipment when you're exercising. And then sleep. Oh my gosh, sleep is an enigma for so many people. And these are just some ways to practice good sleep hygiene and try to get better rest. Avoid using electronics for at least an hour before bed. If you're one of those people who chooses to read on a device, get a blue light filter for it or blue light blocking glasses. Avoid caffeine, excessive alcohol, and sugar before bed. Again, these things will disturb your sleep, even though you think of them as stress relievers. And creating a calming ritual can be helpful, like gratitude journaling, gentle stretching, using essential oils. And if you don't have trouble with getting up at night to use the bathroom already, using a decaf herbal tea like chamomile. Let's talk a little bit about the spirit here. I love to start my day with a positive affirmation. Making time for mindfulness or meditation each day. It doesn't have to be a lot of time. It can be 2, 5, even 10 minutes. I like the apps that are listed here. Being creative is so good for your spirit. Think about things that kids do, coloring, painting, arranging flowers, gardening. And I mentioned kids because playing with them is also really good for the spirit. Remember to breathe, even if you have to put a reminder on your computer or your Kindle or your phone. I know that the smartwatches will set off an alert every once in a while. Breathe, and there's like a nice little color that goes along with it. Connecting with loved ones is good for the spirit and the soul. And then energy healing. Earlier, I mentioned Reiki, therapeutic touch or healing touch, acupuncture, acupressure. These things can help with what we call process work, which means energy might get stuck in the body along meridians that Chinese medicine is based on. And some of these other forms of healing therapies can help move that energy along. And it's why after a session, you may not quite understand it because you just laid on the table and took a little nap. But something that you've been worried about for a long time feels lighter. So that's how energy healing works. I love this quote. A cure is a medical procedure that reliably helps you recover from illness. Healing is an inner process through which the human organism seeks its own recovery physically, mentally, emotionally, and spiritually. And so I hope I gave you some tips to help you experience a better journey on your road to healing today. I thought we could stop before we took questions and just do this little exercise. So this is an acronym for STOP, and it's how you can be in the moment. So let's just get, a little bit, reposition yourself in your chair so you're awake. Stop what you're doing. So if you're fidgeting, you're tired of me talking, you're looking at your phone, you're taking notes, whatever, just stop. And close your eyes if you're comfortable doing that. And let's just take a couple of deep breaths together. So we'll take a deep breath in through your nose to a count of 4. And a deep breath out through your nose or mouth to a count of 4. And keep that going for a couple more breaths. And just observe what you're feeling. Do you feel excited to be here? Do you feel hungry? Do you feel calm or sleepy? Just name your emotion. Don't give it any meaning. Just name it. And take one more deep breath in. And then a deep breath out. You can open your eyes if they're closed. And then proceed with what you need. So stop. Take some deep breaths. Observe what you're feeling, proceed with what you need. So maybe you're hungry, and so it's time for a snack after this is over. Maybe you're excited, and so yay, share that with someone after this is over. Couple of quotes to finish up here. Wholeness is what we ought to be striving for, and part of that is sadness, disappointment, frustration, failure. All of those things which make us who we are. Happiness and victory and fulfillment are nice little things that also happen to us, but they don't teach us much. Everyone says we grow through pain, and then as soon as they experience pain, they say, quick, move on, cheer up. Don't sit in that. I'd like just for a year to have a moratorium on the word happiness and to replace it with the word wholeness. Ask yourself, is this contributing to my wholeness? And if you're having a bad day, it is. So this is just a little reframe for when things don't go exactly the way you want them to go. Is there a lesson that you might learn that contributes to your wholeness? Now that you can see the tiger for what it really is, it's all these things around us, all these things that come at us all day long, I hope that you're able to practice the rest and the relaxation that you need to reduce that fight or flight and to encourage health in your body. My teacher in acupressure, Kathy Miller, says when you treat the spirit, you treat the whole being. My why for integrative medicine is that the practice truly merges healing of the mind and the spirit with the body. And without further ado, I'm happy to take questions. I think I'm right on time.
Awesome. Thank you. Okay, the first one is there any research supporting supplementing with lion's mane and magnesium glycinate for support with multiple sclerosis?
Yeah, so the answer is no, not right now. So magnesium glycinate is a different form of magnesium. It tends to not be associated with GI symptoms. So sometimes people take magnesium and they actually have loose stool or diarrhea. It's meant to help constipation. Magnesium glycinate tends to not cause the GI symptoms that magnesium oxide or magnesium citrate would. There's also a thought that it might be more bioavailable in the brain. But, I think that if you are trying different forms of magnesium, try the one that works best for you. As far as lion's mane goes, so lion's mane is known for its anti-inflammatory, immune modulating, anti-diabetic properties. The data, or I think the way that lion's mane came into the MS world is possibly because there was a study done in mice who took lion's mane, and the ones who did swam faster than the ones who didn't. And I think that's how it became touted as a possible relief for MS-related fatigue. These weren't mice with MS, they were just mice. So there really is no evidence in MS for lion's mane, although the properties of the mushroom itself suggest that it might be a helpful supplement for overall health.
Thank you. If I were a mouse, I would run fast from that lion too. Okay, thank you. Corny, I know. What is the best thing that you can recommend to improve fatigue?
Well, It's a loaded question because you have to know where it's coming from. So the first things that I do in people with MS who are fatigued, the first things I do are assess other causes of it, like thyroid issues, B vitamin deficiencies, sleep disturbances, and mood problems like anxiety or depression. And then I take a look at use of time and energy conservation. And if nothing else is going on there, then I take a look at diet and exercise. It seems counterintuitive, but exercise actually does improve fatigue in MS. And eating just a healthier diet can help improve fatigue. So it's really dependent on the person. The medications that we use in MS to treat fatigue, like amphetamines, modafinil, amantadine, actually don't have great evidence that they work. There is older evidence that something called L-carnitine, acetyl L-carnitine, can be helpful in MS-related fatigue, and I have found it to be helpful for some people. It just can cause a fishy odor to your sweat and urine, so that depends on whether or not you're willing to go for that. But I had some success with that. So again, it's very individually based. There's not a golden ticket for treating fatigue.
Okay, thank you. Lemon water, celery juice, heavy metal detox smoothie. Do you believe these will help us?
So, there are a lot of books on those things. There's a lot of presence on social media about those things. I think that detoxes and cleanses can be dangerous depending on the person and depending on what you're doing. Drinking celery juice all the time can cause issues with, nutrient deficiencies, other kinds. If you are worried about or think you need a heavy metal detox, I think the best thing to do before you start going and buying all of these things that you may not need and doing things that you may not need to do is to ask your doctor to check and see if you have any issues with heavy metals in your blood or your urine. Or if you see an integrative or functional doctor, there are other blood tests that aren't FDA approved, like taking hair sampling or things like that, that can check for heavy metals. And then if you need something like that, it would depend on the metal and what exactly that you need.
Okay, thank you.
So I guess the answer is no, I don't think everyone needs that.
Okay, that's a good way to get to it. All right, next, a person online is asking if holistic medicine is yet recognized by the governments and insurance companies.
So I would say there are certainly forms of alternative therapies that are a part of insurance plans. So many major insurance plans will cover chiropractic care, acupuncture, massage therapy, and sometimes those practitioners may actually use some of these other things like Reiki or therapeutic touch during their sessions with you. So the answer is yes. I've even run across some Medicare plans that cover acupuncture. If your plan does not cover alternative therapies, and you have a health savings account or a flexible spending account, you can use the money in those accounts to pay for those services. So for example, I see an acupuncturist once a month, and when I pay her, I give her my flexible spending account card. So if it's not directly covered by your plan, it is covered under those FSA or HSA types of services.
Okay, thank you. Next, going back to something that was being spoken about earlier in the day, but maybe you can help out with this. A person wants to know what is available integratively for managing chronic constipation, other than using the general fiber supplements. Can you speak about that?
Yeah, so I would start with magnesium. I would make sure that you're drinking enough fluids. If there is no reason why you can't, try to get your water intake up to 64 ounces a day. Make sure that you're moving your body, whatever that looks like for you. If you have issues with mobility, do pick whatever form of exercise you can do based on your ability levels. Sometimes that's enough. If it's not, then sometimes adding in a pre and probiotic can be helpful for the gut. And taking a look at other parts of your diet that might need to be healthied up, I guess would be a good way to say it. If none of that stuff works, then seeing a gastroenterologist would be the way to go.
Okay, thank you. You got somebody in the background there. Okay,
yeah,
there
I'm
you go.
sorry. I didn't think they'd be home.
Hi, Megan. It's Jill. Please tell me how
Hey, Jill.
yoga fits into the whole program.
Sure. So yoga is good for the mind, the body, and the spirit. Yoga and multiple sclerosis, thanks for asking, by the way. Yoga and multiple sclerosis has shown evidence to improve the health of the bowel and bladder. It's or the constipation and urinary dysfunction. It's been shown to be helpful for fatigue, for spasticity, for pain, for anxiety, and to improve a sense of community in MS. So it really does, kind of treat the whole person, the mind, the body, and the spirit.
Great, thank you. And then the last question that I show from online is, does MS begin in the gut?
My answer would be, I have no idea. We don't know the cause of MS yet. So when there is immune dysregulation, that can certainly come from the gut, but it can come from other places too. Functional medicine providers will say that all disease begins in the gut. I disagree, because I think about things that come in from the outside that actually cause the problem. So history of, for example, adverse early childhood events that really get that neurochemistry and that fight or flight going. Your body's flooded with those neurohormones that affect everything. I would say disease didn't begin in that gut, right? It began in the brain. So, and I'm speaking about disease in general, not just multiple sclerosis. So I don't think we know the answer to that yet. And certainly there would have to be a trigger for whatever happened in the gut. And what we do know is the association with low vitamin D, with smoking, with obesity in adolescents, with the Epstein-Barr virus. Those things are associations with MS.
Okay, thanks a lot. We'll see you again soon.
You're welcome.
And I'm glad everybody was educated more today. Thank you. I want to thank you all for being here today. We cannot do these programs without you. Again, I want to thank our sponsors, Novartis and TG Therapeutics, and we look forward to seeing you in October when we'll be back, but we'll be on the south side of Columbus, all right? Thank you. Have a great day.